everyone, and I, Dr. Nikita, welcome you in my Pharma online lecture series. We are going to see the solid dosage form and what are the different unit dosage form included into the solid dosage forms. So, let's have a look what are the advantages and disadvantages of the solid dosage form. So, stability and incompatibility. Solid dosage forms are more stable as compared to your liquid dosage form and semi-solid dosage form because they contain no water or very less quantity of water. The incompatibility reactions are very less. Next, you have manufacturing, packaging, handling. As compared to liquid dosage form and semi-solid dosage form, the solid dosage forms are easy to prepare, easy to handle, easy to pack, and hence easy to transport. So, because of these factors, the manufacturing of solid dosage form becomes economic as compared to your liquid and the semi-solid dosage forms. Next disadvantage is ineffective in certain patient condition. As you know, many solid dosage forms are given orally. So if the patient is unconscious, this route is not preferred and hence the solid dosage form which are given via oral route are not preferred formulation. Next, you have less quantity and high dose. Some potent drugs are there for which the quantity of drug is very less. So these are the quantity which are very less and difficult to weigh in the lab scale, and high dose if the quantity is more then it becomes difficult for ingestion. So high dose formulations are difficult for ingestion for the pediatric and geriatric patients. Next, you have palatability and various environmental factor. So palatability, if you see, sometime masking taste odor is difficult in case of some powder formulations. So the palatability is an issue for oral formulations, high dose powders, and the environmental factor like drug undergo hydrolysis, oxidation, photodegradation. So these are various environmental factors which may affect stability of the drug. So you may need some coating of the formulation or proper storage to avoid the instability or degradation due to the environmental factor. So these are some advantages and disadvantages, and in other lecture I have covered in detail which you can go through. Link I have posted into the description. Solid dosage form, which are the various routes you can prefer. So solid dosage form, various routes you can use. Some small inserts or some mini tablets are inserted into the ocular cavity, so ocular route is also used. Some powders are inhaled via nasal cavity, so nasal route is included. Or various tablets, capsules, lozenges, pastel pills are given via oral route, so it is a most common route. Sublingual tablets are there, buccal tablets are there, so this buccal route and sublingual route is also included. Then some tablets are implant tablets, so they are placed below the skin layer. So subcutaneous route is also used. Some tablets are inserted into the vaginal cavity. Vaginal route is used. Some tablet powders are inserted into the rectal cavity. So rectal route is also used. Some powders are reconstitution powders, so they are dissolved and then they are given. So sometimes the oral solution is prepared, so you can use orally, and sometimes the injectable solution is prepared for from this reconstitution powder and it is given intravenously or they are injected. So IV route or injectable routes are also preferred for also used for this solid dosage form formulations. Labeling, packaging, and storage depend upon the stability parameter of the drug. So you have to, if the drug is temperature sensitive, you have to store at particular temperature. If it is light sensitive, you have to store in amber color bottle. Then packaging, various packages you can use strip package, blister package for unit dosage form. Bulk containers like jar, plastic jars or the glass bottles also can be used for the so storage of the solid dosage forms. Then sachets also used for storing some amount of the powder. Various labeling directions are included. If it is unit dosage form, what is the drug content in that unit dosage form, you have to mention. Storage condition, you have to mention. The frequency of dose, you can mention. How to take that drug, if it's a reconstitution powder, what are the directions to follow to make solution and to take that formulation. If it is uh, effervescent granules or effervescent tablets, whether to dissolve in a solution or a water, and then you have to take. So based upon which formulation you have used and how to take that formulation, you have to write the labeling directions. Sachet. Oh, what are the sachet? Sachet is basically powder formulation or powder which is enclosed into the wafers made up of the rice flour. So up to 2 grams powder you can administer through the sachets. So you can have a look of the small instruments which is used for preparation of the sachets. So in this wet sealed process, you can see you have the upper plate and the lower plate where all the wafers of the rice flour are first placed. So in these cavities, first the wafers are placed. Once the wafers are placed, the powder is filled into the lower portion. So you can see with the help of funnel, the weighed amount of powder is getting filled into the lower half of the sachet. The roller is rolled over the upper sachet, which helps to make the boundaries of the sachet wet. And then these two plates are close together so that when they are pressed together, the water which is present around the boundary helps in the gluing action and stick those wafers, seal the sachet enclosing the powder inside it. Once this is done, the sachets are pushed out so that the sachet can be obtained. Next, you have dry seal sachet. Dry seal sachet is like placing the lid. So you have the lower part and the upper part. Into the lower part, the powder is placed, and the upper part is placed onto the lower part, and they are close together, and it is like a lid action. Edges of the wafers are interlocked with each other, enclosing powder inside. Nowadays, the sachets are not used because the manufacturing or preparation is difficult process. Then again, it is not a convenient method of administration. First, you have to make the sachet wet so it becomes easy to swallow, but it contains large amount of the powder which difficult to swallow. Again, the sachet wafers do not give any protection of the enclosed powder from surrounding moisture, then photo degradation, and they are not sturdy and they may break during the handling process or during the transportation process also. Next you have is the granules. The granules are basically the dry powders, and they may be supplied in form of the single unit sachet or as a bulk container with a measuring device. So there are two ways to take the granules. Either they are directly placed onto the tongue and water is taken, or they have to dissolve in water and that water has to be taken. So this is the picture for the granules, and one of the example we can see is an effervescent granules. So effervescent granules, these are the granules which is a mixture of the citric acid, tartaric acid, and the bicarbonates. So acids and the bicarbonates are mixed together, and when you are adding into the water, they dissolve, they liberate carbon dioxide, and then you have to take that solution. Okay, so these are the effervescent granules, and you can store into the plastic bulk container or the glass jar, or they also can pack into the sachet. On the labeling direction, you have to write the drug content of that granules, then amount of the granules you have supplied in that sachet or in that bulk container, then direction for administration of the granules you have to mention on label, storage temperature or storage condition you have to mention on the label. So let's see some powder and granular formulations. Here I have granule formulation. Ingredients, they added in 10 grams of these granules they have mentioned here. In ingredients they have added, dose they have described 10 gram twice day or directed by physician. Store in cool dry place protected from light. So let's have the inside look. It's a granular powder you can see, which is packed in bulk container. Another I have Triphala Churna powder. Each gram composition they have mentioned, the ingredients which they added in it. Dose 1 to 2 teaspoonful with milk or water in morning or bedtime as directed by physician. Storage direction they have mentioned. This is a measuring spoon inside it, 5 ml or 1 teaspoonful. So it's a powder formulation. We can have a look. Another is a probiotic sachet I have. Content in 3 grams they have mentioned. Various lactobacillus species content they have included on the label. Dose for adult and dose for child they have written on the label. Administration direction they have written. You have to directly take into mouth, or for kids you have to dissolve or disperse into the water or milk or juice before consumption. So let's see how are the content inside the packet. There is also white color granule filled sachet. Next you have is the pill formulation. So pills are the small spherical dosage form, and nowadays pills are not in much use. So you can have look of this pill making board, which on which you have to first roll the mass. So how to prepare the pills? So drug with suitable diluent and the binder mixed together to get the pill mass. That pill mass is rolled onto the this board to the particular length. Upper part you can see has two functions, the rolling and the cutting. Okay, so first whatever mass you have made, you have to roll along with the length. This part is inverted and it is cut into the uniform size, and it is rolled at this portion, and the rolled pill or the spherical shaped pill are collected at the bottom. So pills are again stored into the glass jar or plastic jar. Then you have to label the drug content of the each pill, storage conditions. So next formulation you have is the pastils. What are the pastils? Pastils are the solid medicated preparation designed to dissolve the drug slowly into the mouth, and they are glycerogelatinous and the sugar base. So pastils, you can see this is the pastil mold. So first you have to prepare the mass in which the drug is either dissolved or in dispersed form. So maybe sugar base, gelatin base or glycerogelatinous base. The mass is prepared and it is filled into each cavity of this pastil mold. Once this it is filled, you have to cool it to the room temperature, and then you have to take out the pastil from each cavity. Now the packaging, the pastils can be packed as a strip pack, or they can be stored into the glass jar container or the plastic jar container. Label, you have to mention drug content of each pastil, the storage condition, and how to take, because these are generally used as a cough remedy or throat infection. So you have to suck and chew slowly into the mouth, and you should not bite it. Next you have is the lozenges. These lozenges are sugar and gum based formulation for to dissolve and disintegrate slowly into the mouth. So How to prepare this lozenges? The drug is mixed with the sugar and gum, and the wet mass is prepared. And you can see you have the roller board and the cutter, lozenges cutter. So the mass is spread on the board with the help of roller, spread of an uniform thickness, and with the help of this lozenge cutter, you have to cut the lozenges and you have to expose for the drying. So this lozenge cutter can be of different shape. It can be of circle, rectangle, triangle, square. So these are the different shape cutters are available for the lozenges. And these are some square shape lozenges diagram I have taken. The use is basically used as a cough remedy for the throat infection. They are also packed individually as a strip pack or can be stored into the glass jar or the plastic jar container. The content into the each lozenge you have to mention onto the label. Then you have to write the directions, that is not to bite, it has to be chewed and sucked slowly into the mouth. Then you have to write the date before which you have to use that formulation. The various key points to remember is the definition of that formulation which you have prepared, route through which you are going to administer, various advantages, disadvantages of that formulation, labeling directions, different packaging which you can use, storage condition, and the various examples you can give for that particular dosage form. So kindly like, share, subscribe my channel. Enjoy learning and keep growing. Thank you very much.